So one of the techniques for microglia that is very interesting, but not my specialty, so I don't know enough about that, but is adaptive optical coherence tomography. However, there's one camera that we are now also looking doing a study with from the company called Optina in Canada, and they developed a artificial intelligence algorithm, and they've gathered thousands of cases from different study sites, and we are one of them, so we are collaborating with them. And they use amyloid PET data from the brain as a control, so as a biomarker control. And these cases are included with imaging data from their AI device. And what they do is they have a hyperspectral camera, and they make images from the retina with lots of different wavelengths of light. And by the pattern that we receive back from the retina, they can the algorithm can show us differences, or can actually distinguish between Alzheimer's disease or Alzheimer's disease actually cases with amyloid PET positive data and amyloid PET negative data. And that is still in development, and we are one of the study sites that are collaborating with them. So that would be, if that would work, and also in the practice, that would be a way to label-free pick out people that have an increased risk for Alzheimer's disease. And if it's based on amyloid in the retina, or if it's based on something else in the retina that people with Alzheimer's disease have, that's still uncertain. Well, at the moment I'm working on further studying the microglia. So also for the microglia we are using an artificial intelligence-based algorithm from another software company called Visiopharm. Because what we did now, and the data that I presented, was mainly on quantifying the immunohistochemistry mean surface percentage in the retina from different markers that show activated and total microglia. But there's also a lot of information in the morphology of microglia, because based on the morphology of the microglia, we can tell whether the microglia are activated or more in resting state. And this Visiopharm algorithm learns the different layers of the retina, so it can detect the different layers of the retina, and it also can detect where the microglia are located, and also using different variables can calculate the morphology. This is still preliminary data, but we plan on expanding this data. And another project that Jeroen Hooseman is working on is proteomics, because what we've done now was just pick out interesting phosphoepitopes, for example, or markers to study whether these are increased or present in the retina. But what is also very, very interesting is taking punches from the retina, doing proteomics, compare between the groups, so AD controls and AD-related neurodegenerative diseases, and then look which proteins come out as specific, and then do additional immunohistochemistry with these proteins.